guys, welcome back to Medical Coding with Blue. Today's episode is all about why you should not work for free as a medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I see a lot in the comments about, well, no one wants to hire me, so maybe I'll just volunteer someplace so I can get experience. Or maybe I should just volunteer just to get my foot in the door somewhere. Or maybe I should just take a position as a secretary, and if they say that I can do the coding, then I'll just do the coding then. Okay, so here's the thing, guys. Here's why you should never work for free. Now, working for free and doing an externship are two different things. An externship is usually involved with the school, and so that's something different because that's a requirement of completing a program. Externships, internships are usually a requirement of completing a program. All right, so that aside, I'm talking about like just going to a place and saying, hey, I'll volunteer because I need to get some experience in medical coding so that I can get my foot in the door someplace else. Here's why you shouldn't do that, guys. Because to become a medical coder, it takes time. It takes time, it takes money, it takes energy, right? And not only that, it doesn't matter if you are the one that is the person who's paying for it, or if you're going through a program and they're paying for it. Somebody paid for this program. So there's money that went out, and time is money. So if you are with a place and you're just volunteering with them and you're giving them your time, you're not just giving them your time, you're also giving them your knowledge. And you're doing this in an industry that is a multi-billion-dollar industry. You know, healthcare and all of these things, it's in the billions, y'all. And it's not that these people are poor. These clinics are not poor, all right? If they don't have money coming in, it's because they don't have somebody, one, that's managing the money right. Number two, they don't know how to bill. Number three, they don't know the fundamentals of documentation so that they would be able to bill properly and appropriately. But that's another video for another time. But that is not your concern. Them being poor and, oh, we can't hire nobody, that's on them. That is a very poorly run clinic. That is a very poorly run doctor's office. And you'll see that a lot. You'll see that a lot because a lot of times what happens is it's the spouse of the doctor that's usually running those private practices. And oftentimes, not all the time, often, these are people that they don't have any experience in billing. They don't have any experience in medical coding. A lot of times these spouses will actually refuse to take classes about these things because this is the way they've always done it. It's always been billed and paid and it's been fine until an audit happens. Until an audit happens. So then that's when they see all of the errors and everything that went wrong. But these are easy to fix if you just take a class, okay? But that's, again, another story for another time. You don't need to get involved in all of that, okay? If they're saying that they don't have enough funds to hire you, that's not the place you want to be at anyway. Because even if they did hire you for something else, they're going to pay you less than what you need to be paid. Because sometimes people don't understand how to pay employees so they can get quality work and they can get quality results. They don't know anything about that, and it's just a kind of a greedy approach because they want to keep as much money as they possibly can. Well, if you do that and you don't hire the right people, you know, I'm just going to leave it right there. But with that said, you volunteering for any place like this, again, you're wasting time and you're wasting money. Because guess what? Even though you're using your skill and even though you're using your knowledge and everything like that, guess what happens when you've been there for paying to go to work and doing all of these things? Because basically that's what you're doing. You're paid to go to work and you're doing this for a month, and then all of a sudden they start seeing money coming in. And oh yeah, well, we have a coder now, and so they've been volunteering with us, and all of a sudden, you know, now we've got money coming into the clinic. Oh, okay, well, I mean, this is basically a free resource because they just want to get their experience. So we'll just keep them on. Well, 6 months goes by and you still haven't gotten paid. This is a story that I have heard before. That this lady, she worked for a doctor doing this because she wanted to get experience and that's all she thought she could do. And that doctor took advantage of her. And it does happen because, number one, he says, okay, this is free labor, and she's willing to work for free because she just wants to get that experience. Well, do you think that that was good for her? No, because guess what? When it turns out that you have to have this letter that you have all, you did this experience and things like that, does it really count for that next employer and for, the experience that they need for that particular clinic? Or did you use an electronic record that is relevant to their practice? So that's just part of it, guys. They can pay you because what coders do and critically think their way through these encounters, and when they get submitted to billing and everything is billed cleanly and all of these claims are processed, and all of a sudden all this revenue starts to come in, and there's all of this extra money and all of this money that comes in, and if you are not stepping up to the plate and advocating for yourself on your salary and the things that you need, and you're just letting this person keep all this money, unless that's a good person that's saying, you know what, I feel bad because they've been working for free and I'm going to give them money. Do you think that happens? More times, no, it does not happen. That person's going to be willing to keep the money because you were the one who wanted to give away your skill for free. So don't give away your skill for free in an industry that is multi-billion dollars, okay? Don't do it. These doctor's offices, these hospitals, they can pay you. They can. And if you say, well, let me try to be a secretary, and they say that as a secretary, I will be able to help with the coding. And then they start giving you like a super bill to just circle the codes, and then maybe you're doing the charge entry and things like that, and they're calling that coding. That's not coding. That's charge entry. That's not coding. That's just charge entry. And so again, you're wasting your time. And not only that, they're getting two positions out of you at the same time. Not only are you having to do the secretarial work, but you're also doing charge entry. Charge entry that they typically hire somebody else to do, one person to do full time, right? And you are just sitting there doing both jobs because you think that that's going to help you to get some experience onto your resume. But meanwhile, you're still not coding because that's just charge entry. You're working with the codes, but you're not selecting them. The doctor's telling you because the doctor's thinking that that's the code that they need to select. See, what happens is these doctors are not designed to be medical coders. There's a small minority, though, of them that do have their medical coding certifications, and they do know. They do know the difference in these codes. And I think that's fantastic. When a doctor gets a medical coding certification, I think that's fantastic. But at the same time, it doesn't always happen. It's almost rare to see it. But when it does happen, and they do understand, then that's something that's different. But the vast majority of them don't know. And sometimes they will go to conferences where they will have like a speaker that they say, oh, well, we're a coder and this is what you should be doing. And then when they get back to their facility, those things that they were educated on don't apply to that particular provider working in that particular setting. But now this doctor thinks in their mind, this is what they need to code and this is what needs to be reported because this person at a conference said it. And I've seen some of those handouts that have come back from conference. I'll say, no, no. That does not apply with us. That does not apply here. And so having to explain all that. But this requires compensation for my knowledge and for your knowledge as a coder. It requires compensation. It is not for free. It is not so that, oh, well, it's just so that I could get my foot in the door. If you allow yourself to be taken advantage of, people will take advantage of you, and they will have no remorse, and they will have no qualms about taking your knowledge, none at all. So I'm telling you, as someone who's been experienced in this field for several years and seen the amount of money that medical coders make for facilities and make for physicians, and how they can pay you. They can. Maybe it's not going to be this high dollar crazy amount that these schools are trying to hawk, but it needs to be something that is reasonable because number one, look at this economy and look at how all these things are so expensive now. Gas, food, rent, mortgages, cars, insurance, all of these things cost money. You should not have to be giving away your technical skill in order for somebody else to benefit. They need to pay you. You do not need to work for free. I've had people who tell me, well, Blue, I know you said not to work for free, but I'm going to go ahead and do it anyway. Okay, then why even tell me? Why even tell me? Because you're going to do it anyway. I get it. And good luck with that. And I will tell you that even though they say, well, they just told me that if I work, for 6 months and then they may hire me, they may not hire me. And then they want to give you entry-level pay. Even though you already have experience, because of the 6 months they ran you through the gamut and didn't pay you. Now they want to give you entry-level pay. And you still want to stay there? Why would you want to stay there? Why would you want to put yourself through that? Again, there are plenty of places for you to apply. This is the important thing that y'all need to know. If you hear anything that I say in this video, is to be patient with the hiring process. If you are not patient with the hiring process, this is what can happen. Let me work for free so that I can get some experience on my resume. But then at the same time, is this person going to say that, yes, you did the coding? Are they going to be able to vouch for you? Are they even going to want to turn you loose? Because at the same time, you've just worked all this time for them for free. Why would they want you to go anywhere? And if you're really good at what you do, again, even more reason, all right? But here's how we can counteract all of this need to work for free. Go back to your books. Go back to your workbooks. This is how you prepare yourself. This is how you get ready for your forever home job. You go back and you practice, practice, practice. If you are not practicing while you're out there applying for jobs, you're letting your skill get away from you, and then you have the nerves to say, oh, well, does anybody know how to be able to maintain my skill while I'm not looking for a job? You practice. You literally practice with your workbooks. You go on to websites like justcoding.com that have 5-question coding quizzes for the free membership that they do have, right? Because they have a membership that's paid and then a free one. I recommend the free one. Why? Because I try to give y'all all of the resources that you need to as a new medical coder, right? Who's not working yet, and that's going to help you. But you have to help yourself, y'all. You have to be able to get into those books and start working with them, and start working with those 5-question coding quizzes, and reading the recent coding guidelines, right? Because they're out for free on the CMS website, cms.gov. You can Google it. The ICD-10 CM Coding Guidelines 2024, the PDF will pop right up. If you've listened to any of my other shows, you know how to listen to them, or you can read them, if you don't have the latest 2024 editions. I did post, not an ad for Optum, but I did post the, it was a photo that I did of their prices for the 2024 editions, which is still a great price. You're still getting a fantastic deal. If you look through the books and you look through the ICD-10 CM books, you will see at the beginning of every chapter, they have examples, they have the answers, and they have the rationale on how they got those answers. If you take the time to practice through each and every single one of those chapters, then you will have covered the whole book, the whole diagnosis coding book. If you take the time to go through your CPT manual and look at the modifiers and look at the E&M guidelines and look at, all of those things there, again, another great way to practice. Another fantastic book for y'all to learn from is the E&M guide from the Evaluation and Management Guide from Optum. If you go to the Optum website, optumcoding.com, and you go to the medical coding specialty, and then you see the best deals, you will see right there, you can look for the Evaluation and Management book. And so that way it can help you. If you order that book, it's a fantastic price. I don't know what it is off the top of my head, but it's there and it's a great deal and it will help you. I have that book. I think it's a great book. And so that's one thing that can help you if you're struggling with E&M. E&M is not as difficult as everybody tries to make it out to be. Really, all you have to do is take the time to practice with it, okay? And looking at your books and continuing to do that practice will help you in your preparation for your forever home job. And so that way you can get out there and be, ready whenever they do call you. Because when I hear from people that say, well, I applied for 100 plus jobs and I still haven't gotten a call, because probably there's something wrong with your resume. And I don't feel like talking about resumes anymore right now, because I feel like I always talk about resumes and how important they are, and how that's going to be your mouthpiece when you're out there. But when you are trying to apply for these jobs and you're trying to get your foot in the door, it's very important to keep an open mind and not to just pigeonhole yourself into, oh, I only want to work from home, or, oh, I only want to do this, and, oh, I only want this kind of pay, and you haven't earned it yet. I'm going to be real with y'all. I've seen a lot of unrealistic expectations for new coders simply because they were a nurse before. So they feel that they're entitled to all of this big dollars when you haven't even been a coder yet. Or other people that say, well, I have all of these degrees and nothing to do with medical, but they want all this big money. Why would a business do that? That's just plain common sense. Why would a business do that? A business has to be able to keep all of their expenses as low as possible, of course, without hurting themselves with on quality and things like that. But they have to be able to keep their pay at a normal rate, and they can't just be trying to just give all of this high dollars when you haven't earned it and you don't have the knowledge to back up those high dollars. It does take a little bit of time to learn, but once you do learn it, then you'll be okay. That's just what I want to say about that. And when I look at some of these things that people are saying, about the work search process and things like that, and they're just like, why can't, everybody just want, new coders? Because these schools oftentimes push these people through very quickly and they don't prepare them. You can prepare yourself. You totally have that ability to be able to prepare yourself. In every single one of my videos, I have the independent study video link. And that link to that video in the description box has the whole syllabus for how you can study. Now, I've tried to keep it up to date, but if there's some things that are like a few years old on that list, it's just use common sense, guys. Go for the current year version of that particular book or that particular link or whatever. And so that way you're going to be studying the most up-to-date things, So that's just what I want to say on the subject. But it does take quite a few applications. It does take quite a bit of persistence in order to get in, and that's what you need to know, because it's never going to be handed to you, guys. It never will be, okay? But you working for free is not the solution at all. And the more people try to do this, the more that the industry is going to think that this is okay to do. It's okay to make people work for free, and it is not okay, especially as an industry that requires continuing education units. It requires us to maintain our knowledge. It requires us to have the most up-to-date knowledge. And these guidelines and rules change every single year. You cannot make people work for free. And people should not be subjecting themselves to be working for free in the first place, okay? So again, stay away from those roles that's going to make you do double duty, like being a secretary. A medical secretary is very important. This is a vital role, in the whole healthcare process. However, if that is not your goal, and your goal is to be a medical coder, then you need to fix your goal on how you're going to be able to get there. And how do you get there? You get there by being patient through this work search process. You do that by applying for jobs. And, even if they're asking for 3 to 5 years of experience, you're still applying anyway, especially because if it is a medical coding position and there are happy coders in that area, they are going to stay where they are. So that employer is going to have to take whoever is applying. And again, if you have the guts to go over there and apply, you're going to be the one that gets the call. not the person that's not applying or gets so defeated and so into their feelings that, oh, I can't find a job, I can't find a job. And they're not trying to work and do something else. You know, when I was looking for a job as a medical coder for 2 months before I went to the temp agency, and I tell y'all to go to the temp agency, and then it's just a back and forth thing. So go to the temp agency in your local area, not these yahoos that you see on LinkedIn. Okay, those are not temp agencies. Those are headhunters. Those are those people. But when I was looking for 2 months, I still continued to work. I still continued to work as a bartender in a halfway house, and all these things that I was doing to make money, I still did while I was looking for a job as a medical coder. Just because you're looking for a job as a medical coder doesn't mean that you have to stop working or that you can't take other assignments until you find a actual job in medical coding. Okay. So that's just the way that it is. And you have to be persistent. And people that are persistent are surprised when they see, oh yeah, well, I got an interview. Oh, Blue, I got the job. Well, there you go. There you go. And wherever you start doesn't mean that's where you have to stay. If you want to end up staying there for a little bit and then going on to something else, that's just as good too, guys. You can do that, because you don't want to stay someplace that you're not going to be happy or you're not growing. You want to continue to grow, and you have to think of yourself. And don't think of, oh, well, you know, I just want to be nice and work for this place for free, because no. Because if it was turned around, they would not work for you for free. Think about that. They would not work for you for free. And again, you have skills and you have knowledge, and that deserves compensation. You do not deserve to work for free. But again, if you want to be hard-headed and you want to work for free, by all means, you go right ahead. If it works out for you, that's wonderful. But at the end of the day, that's not the usual case. So I'm telling all of my people, stop saying that you want to work for free just to get experience, because these people, they can pay you. And that's all my message for today. So if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.